We have started to record the most recent session of SPCH 1113, Introduction to Public Speaking, for the first summer session. It is Monday, June 9th, 2025. This is Informative Speech Week. Today is Informative Speech Research. Tomorrow is Informative Speech Topic Selection. I have a number of presentations over the next 2 days that I am going to show you, with the proviso that you are serving primarily as a teacher or lecturer when you are informing a class. The nice part about having an online class such as this is that you can go not only to my YouTube channel, but you can also check out some of the links that I am posting on Blackboard. We did a very nice job with a limited amount of preparation time last week for the demonstrative speeches, and I'll talk about that in just a moment. A reminder that you can always check these videos in real time because I record them on the same day that they are posted. Let's go to our last class session. I will leave it this size on Loom so you can see the transcript on the right-hand side, and I will play bits and pieces from our most recent class session. We have started to record the most recent session of SPCH 1113, Introduction to Public Speaking, for the first summer session. This is Demonstrative Speech Day 2. It is Thursday, June 5th, 2025. A reminder, guys, that from now on, we will be meeting on Mondays, Tuesdays, Wednesdays, and Thursdays. So you will have 3-day weekends. We will resume, and I'll show you on Blackboard in a few minutes the way our schedule is going to be set up for next week, which will be informative speeches. For the time being, I wanted to show you what it looks like from my library on Loom. Everything that we have done so far this semester with classes going to session 1 are available, and it's from this location where I am taking the instructor course videos, providing URL links here and placing them on Blackboard. Trying to be consistent in speaking in a complete sentence structure. So that brings us to our third presenter of the day. And this is Serenity Golightly. Serenity is a member of the SAU basketball team, and she is going to be giving a presentation today called The Fundamentals of Form Shooting. Her audio is a little bit on the low side. It reminds me of Charlie yesterday. So it may be a situation like Charlie, where in Serenity's case, you may want to get just a little bit closer physically to your webcam to speak, or double check the presets for the audio level on your computer. Again, it has no bearing on anyone's grade, but her audio is a little bit on the low side, at least on my computer. Our third presenter of the day for demonstrative speeches, day 2, Serenity is going to be discussing the fundamentals of form shooting, and here it is.
Hello everyone, my name is Serenity Golightly, and this is my demonstrative speech for Intro to Public Speaking. My topic will be over the fundamentals of form shooting. A little bit about why I chose this topic is because I do currently play basketball at SAU. I will be going into my sophomore season in the fall, and these fundamentals were instilled in me at a very young age, and I wanted to share these fundamentals with all of you guys today. So what will you need? All you need is a basketball and a goal if you have one or you can access one. If not, that is totally fine. All you will need is yourself and a ball to do these basic fundamentals.
Headphones, so we're not getting any issues with double audio or feedback. When you're informing, you're serving more as a teacher or lecturer. But now you've got a 3-day weekend where you can sit back, relax, maybe go to my YouTube channel or just go to Blackboard and see an example of what people have done for informative speaking. So you might want to do some preliminary research, but don't feel like you have to do anything yet because now we're into the regular rhythm of putting together your speeches one a week, whether it's 4, 5, 6, or 7 minutes. But like I said, I am a positive person. I don't get hung up on grades all that much because if you're doing the things that I think are important, the grades will take care of themselves, which more than likely will be posted sometime on Monday afternoon, right around the time I have posted the Monday class session for next week. As for SPCH 1113, Introduction to Public Speaking for the first summer session of 2025, enjoy the nice long weekend. Keep in mind, gang, Monday, Tuesday, Wednesday, and Thursday only, and we will return on Monday afternoon. So have a nice long weekend, and we will see you on Monday. I really try to practice what I preach in terms of watching my performances back and back and forth to make certain that there is no misunderstanding or confusion about anything that's related to the course. You'll notice that I was talking a little bit about grades at the end of Thursday's class session. With that in mind, now let's go to the student preview mode on Blackboard. From this location, I have an updated announcement. Informative Speech Week, Monday through Thursday, June 9 through 12. A reminder that informative speeches will be submitted for evaluation no later than 2 p.m. on Wednesday, day 1, or Thursday, day 2 this week. Continuing, demonstrative speech grades are posted. Keep up the good work and watch instructor course videos each day. And I have already posted your scores on Blackboard with a maximum of 20 points. We all did a nice job. But as I said at the end of Thursday's class session, I don't get hung up on grades because at the end of the term, the only thing that matters is did you break 90, 80, or 70? If you are going through the steps that I think are appropriate for your content delivery and visuals on a weekly basis, you'll probably do just fine. And with that in mind, now let's go to the content area on Blackboard. Open up a few of these folders. Come back up to the course syllabus area and examine this week's course itinerary. And I have all of that on the screen now, including informative speech topic selection, which is tomorrow. And then, of course, day 1 for the speeches, which begins in 48 hours. And before I go to the course speech schedule, I wanted to remind all of you that just because you spoke on Wednesday one day does not mean you always have to go on Wednesday. Sometimes, if you want to go on Thursday, that's fine. It could be very simple that, let's say, for the demonstrative speech and for the informative speech, you spoke on day 1, but maybe needed a little bit more time next week for the persuasive speech or the last day of class, which is coming up relatively quickly. In terms of the course speech schedule, and make this user-friendly so I can get all of this data on the screen. Summer sessions go by very, very quickly. Before the end of this week, we will already be at 11 of 19 class sessions for the first summer session. That's why time management for all of you is key to your overall success, which is why watching all of those videos and then watching the takes that you do not send me where there might be an issue with content or visuals or anything else that would impede the progress of a particular take. That's how you learn. In a real world face to face circumstance, you're probably not going to be able to edit the tape, so to speak, in a way that you would from an online video course, especially in public speaking. But it teaches you the discipline, not necessarily to make any mistakes with vocalics or drop G's. And I really didn't hear a lot of those, which brings me to the SAU speech critique, which of course is the informal checklist. When you're going through any of these items with content or delivery or visuals, just always have it in the back of your mind as I go back to the top very slowly, how you can improve in each of those areas. We have one speech down. We did quite well, but now we turn the page from a how-to speech to more of a formal presentation. Under the student speech video examples, I have one of each, which I will probably continue to populate. And the student speech video examples, I have from your class, how to make buttons and the fundamentals of form shooting. We saw just a little bit of that from Serenity a couple of minutes ago whenever I was showing you bits and pieces from the class session on Thursday. But I don't want to waste a lot of time today. I really want to show you some examples of informative speeches. And then we'll go into more detail with the outlining structure tomorrow. I have two examples from summer one of 2024. I have one from the first summer session of 2023. These three individuals that you're going to be watching today, gang, are not only good examples of informative speaking, but they all had exactly the same amount of preparation time as you're going to have. This is Emma Johnson. Her topic for informing the class is mental health matters. You'll notice her time is about 6 minutes. My guess is as you feel more comfortable with Loom, you're probably going to be a bit more expressive and the time might expand a little bit. Most of you who have the 30-day free trial on Loom, time's not going to be an issue. So if you want to go a little bit over, that's fine. I had presentations last week, as you're well aware, that ranged from 4 or 5 or 6 or 7 minutes. This is Emma Johnson, her informative speech, Summer 1, 2024, and she is focusing on mental health.
Hi, my name is Emma Johnson, and this is my informative speech called Mental Health Matters. This is just an informative speech about mental health and what it is and kind of more information on it. I chose this topic because I'm a psychology major and it just was something that I feel like I'm passionate about. So what is mental health? The true definition of mental health is the overall well-being of your emotional, psychological, and social health, as well as even physical health can contribute as well. Sometimes when you don't take care of your mental health, it can lead to physical issues or you could get sick, possibly. It can lead to stuff like that also. So that's why mental health is so important to maintain so you can live a healthy and a happy lifestyle for yourself. How does mental health affect you? Mental health is something everyone should be aware of and make sure is accounted for in their personal life. Things can get bad quickly if you don't manage any type of stress or trauma properly. Everyone goes through many different things every day that affects them in multiple ways. You hear that saying that's like, you need to always treat people with kindness because you never know what someone is really going through or what someone is dealing with on a personal level. As long as you manage your stress and take care of yourself by not overdoing it, you should be able to manage your mental health and do it in a healthy way. Dealing with traumatic events, though, can cause concern for more drastic treatments, such as medicine, therapy, or time off of work or school. And all of it affects everyone in different ways. It just depends on how you are. Why does mental health matter? Mental health is so important to take care of. If you're not careful, bad mental health and many mental illnesses can lead to suicide. This is why it is so majorly important to take care of your mental health and to also check in on others, your friends, your family, and just to make sure they're doing okay. Suicide is never the answer to any problem that you run into in your life. If you or another person you know is showing signs of being suicidal, then you definitely need to reach out and get help from, some form of support or call the suicide hotline 988 as soon as possible. But the three main factors that control your mental health is your thoughts, feelings, and actions. So when your mental health is not doing so well or you are feeling sad or down, it can affect your thought processes and ability to concentrate or give you confusing thoughts about what to do. Mental illness can cause you to feel a lot of different emotions. These emotions can make you feel depressed or anxious and can be an underlying mental illness. And thoughts and feelings kind of mix in together with each other, but they each have their own individual meaning. Actions, your thoughts and feelings affect your actions. If you are having feelings of sadness or you're upset, it can cause you to act differently and affect your daily life. As humans, as people, we act based on our feelings and thoughts typically. When should you take action with your mental health? When you start to feel any symptoms of any type of mental illness or think you might suspect you have one, you should go to the doctor as soon as possible and let them know what is going on so that they can help you. There are a lot of different types of mental illnesses out there. Some can be easily treated while others can be more complex and require more action than others. As well as if you see someone else who might be struggling, not just yourself, you need to check in on them to see if they possibly might need help or even just someone to talk to. It is so important to have support from family and friends in life to help encourage you. Even if your friends say they're fine, sometimes that's not always true, and you just need to check on your friends and family on top of yourself. And only you know what is going on inside of your head. And that's why you need to take action when action is needed. It can be, something as simple as just taking a mental health day off from work or school or, just, getting some self-care and doing what is right for you mentally to help you if you've been very stressed lately. And, it doesn't always have to be, going to the doctor or getting put on medication. It can be something as simple as taking the day off from work or school to, spend time with family or by yourself or just to relax. It can be as easy as that, but, not all cases are like that. Everyone is different. What should you look out for? So some symptoms to look out for are changes in mood, feeling overly tired all the time, insomnia, changes in appetite, impulsive behaviors, overwhelming feelings of fear or anxiety, changing of feelings in things you normally take interest in, hostile or violent behavior, any type of substance or alcohol abuse, or any type of social withdrawal. All of these things could possibly be an underlying mental illness and could possibly mean that you need to reach out for some type of help or, need to reassess what's going on. And these 4 sites are my works cited, and that is everything that I have for you today.
And it would be nice if she would say thank you. I told you during Thursday's class session, a couple of you were jumping the gun on stopping your recording. When you have completed a presentation, you probably want to say thank you, and then in the back of your head count 1001, 1002, 1003, and then pause. What you'll notice about Emma is not only is she informing us about the importance of mental health awareness, She has practiced so much that she has a relatively smooth delivery, and many of you did that last week. A couple of you might have been disjointed, had a couple of issues with grammar. You may have noticed she dropped a in there, which is a small thing. But if we just want to now look at some of her graphics from the standpoint of design consistency, she has all of these bullet points, which does not necessarily mean that she has to talk about all of them, but bits and pieces with time management in the back of her mind, how she respectively is going to go through one or more of them, which is much depth or specificity as she thinks is important. When you should take action with mental health. This is written more in a slight paragraphing style, but it certainly is going to work, because when you see that second paragraph where people might be struggling, check in on them. And that certainly can be very stressful, especially if you are a college student and you're doing all kinds of juggling. Why does mental health matter? Thoughts, feelings, actions. Very helpful from an informative standpoint. And then we continue to scroll back. How does it affect you? She has more than enough information. So if she wants to generically talk about this image or talk about bits and pieces of this, for instance, quoting, as long as you manage your stress and take care of yourself by not overdoing it, dealing with traumatic events can cause concern for more drastic treatments. Because there will be so many people that you're aware of who might be blissfully ignorant of some of the warning signs from their own personal standpoint of mental health. Defining the term is always helpful, because you can never assume everyone knows every last item about the subject of mental health. So nothing calls attention to itself in terms of a lack of preparation here. Webcam in the upper right-hand corner, very solid, and keep in mind that was just 1 year ago. Which brings us to our second example, also from Summer 1, 2024. What you just saw from Emma is one of the links that are available from previous student courses 20 to 24 that are available right now on Blackboard. This is Marilyn. You may remember her from last week, where I showed you her demonstrative speech discussing the topic of a homemade felty. In this case, she is informing us about the relevance of occupational therapy. Here it is.
Hi, my name is Mariela Knuckles, and this is my speech for the second week of Introduction to Public Speaking for Summer Session 1. Today I will be introducing to you all the topic of occupational therapy. What is occupational therapy? Occupational therapy is an important medical career that helps individuals with daily tasks. It's a branch of healthcare aimed at helping people who have physical, sensory, or cognitive issues or delays. Common ways occupational therapists help patients are by teaching new ways to perform daily tasks, demonstrating how to use assistive technology, educating caregivers on how to help them best, creating daily routines that promote independence, and showing strengthening and stretching exercises. It also promotes independence in patients and aids patients in developing their motor skills, regaining mobility, and improving functionality. They may assist disabled or injured individuals as well. Who does it serve? Occupational therapy serves patients with temporary conditions such as strains, sprains, or breaks, those who have disabilities that are physical, mental, or learning, such as sensory processing disorder, developmental disabilities, or amputations, or chronic conditions such as carpal tunnel. I have carpal tunnel, and I have been to occupational therapy several times, and also arthritis. That is another chronic condition that might be treated in occupational therapy. Certain diseases and disorders very often are seen in occupational therapy settings as well, such as cerebral palsy or Parkinson's disease, and those who have a history of a stroke. Stroke patients very often go to occupational therapy because they have to help relearn their fine motor function skills and also their cognitive development. The ages that attend occupational therapy, well, all of them. Newborns, children, teens, adult, and the elderly all can go to occupational therapy if they need it. In the workplace, I've included here a video clip of a pediatric occupational therapy clinic and the day in the life of how they take care of and help children. So what do pediatric occupational therapists do? We're about to find out. So play and social interaction skills. This is very important for children to learn and develop, as well as visual motor skills. Visual motor skills and fine motor development are also often used in helping stroke patients because they have lost a lot of the ability to do certain things. Fitting kids with supportive splints, people of all ages can have these supportive splints if necessary. Feeding skills, a lot of children, including babies in the NICU, fun fact, will need to see an occupational therapist before they are able to be discharged from the hospital. This is because they have not been able to learn how to use their mouth to eat food and they need help in order to do that. Now, it might not be very fun, but it is a very true fact. It also mentions self-care, which is another very important factor of occupational therapy, and it helps all patients with their mental and emotional health. Tools and techniques. Some of the techniques that are used in occupational therapy include red light therapy and cold laser therapy. What to know about cold laser therapy? Cold laser therapy is typically non-invasive and painless. It's used to improve healing and blood flow to injured tissues, and it's also often used in the formation of this gun-type product that's shown in the picture, and it's put against trauma-caused tissue or other injured tissues, and research shows that reduced pain for some conditions but no increase in functional movement is very often occurring. It may be done as part of a well-rounded rehabilitation program. Some of the tools involved in occupational therapy are resistance bands, which is pictured here. They help with muscle development, the improvement of stretching muscles, and also re-strengthening muscles after there's been some atrophy. Flex therapy bars, pegboards, and therapy putty are all also used. A TENS unit is used. TENS unit, that stands for Transcutaneous Electrical Nerve Stimulation Unit. It uses low voltage electrical currents to relieve pain in several different types of patients, and other objects that are used include dumbbells, exercise balls, and even toys. The annual wages in the U.S. for occupational therapists by state as of May 2023 is shown in this image here. Arkansas is shown here in the lower end of the mid-range for the annual wage, and the top 5 are shown on the left, with California being in first place, leading with a mean wage of $113,550, New York being second, leading with $107,530, Nevada being third with $107,070, and New Jersey being fourth with $105,880, and lastly Colorado with $104,950. So occupational therapy versus physical therapy. This topic is commonly known between a lot of people, especially medical students who are getting a start out in their career path or in their educational path. Occupational therapy is a lot different from physical therapy, but they both do often coincide or can work together if necessary. Occupational therapy has a much more holistic approach. They focus more on emotional and mental health as well as physical health rather than just physical health, which is what physical therapy mostly focuses on. Physical movement approach is the top priority for physical therapy. whereas occupational therapy aims to help with self-care, daily living necessities, and improving the overall quality of life. In physical therapy, they aim to get patients back in motion, perform body movements, and even improve the quality of movement. Thank you all for watching. Here are some other tools and objects used in occupational therapy, including this toy on the left here. And I hope you all have a wonderful day. I hope you've learned something new about occupational therapy, and I hope the subject interests you. Thank you.
I intentionally let that run a little bit longer because you'll notice that Marilyn puts a lot more what I would call air at the end of her presentation. So she concludes it right around 7:10 or 7:11, and then she's got a little bit of filler time to get to 7:19. Keeping in mind, folks, that when you are informing or persuading or even doing your wildcard presentation, by nature, these three presentations out of the four in the first summer session are going to rely on research, on data, on statistics. Especially when you're informing, there's going to be a lot of data that you go through. If we, like what we had with our first presenter, just start scrolling back, occupational therapy versus physical therapy. What are some of the holistic approaches? What are physical movement approaches? All of this is designed to help you not only inform the audience, but to fill the time. And then we just continue to scroll back looking at annual wages in the United States. So if that's something that you're concerned about, then you know that in California, the mean is that amount. And in Colorado, it's that amount. And then depending upon the color variation on the map of the United States, you're going to be making more or less in terms of salary. These are the types of statistics that are helpful in letting us understand the finances of being involved with occupational therapy. You also have, with tools and techniques, very attractive text image balance with the techniques and the tools. She's not mentioning everything here, but it's your security blanket. Because you'll recall whenever she put this slide up, there was nothing on this side. Let's see if I can show you this in real time and play it. Just waiting for, there we go. Now let's mute the audio and just play it in real time. She's intentionally waiting to pop that up on the screen. And then if I let this play a little bit longer, she's going to take the second graphic and pop it up there too. Whatever slideshow tools you want to incorporate, depending upon the platform you're using, that's fine with me. Whatever is going to help the audience learn from your presentation. Because you'll notice, first with Emma, now with Marilyn, both from Summer 1 2024, they are, look at the eye contact. She and Emma are both really concentrating on the subject matter. That shows me not only that you've done your research, but you've done a lot of practice deliveries. And then there's the second generic visual that comes up. And that is some type of resistance band. Then just continuing to scroll back. And you should do this as well. Let me go back a little bit further because she's going to be playing video from this slide, but talk her way over it. She's not going to use the audio from the video that she incorporated into the slide. She's going to do a voiceover. Check it out.
How they take care of and help children. So what do pediatric occupational therapists do? We're about to find it.
And then even though I didn't do it with Emma, we can here with Marilyn, just pop up closed captioning, double check how the quality of the closed captioning is reinforcing one's ability to be extemporaneous and conversational. and we'll take the closed captioning off. We'll pause it, and then just continue to scroll back to who does it serve. So again, you've got very nice design consistency, and most importantly, you need to define some of these terms because people don't know, if they're not familiar with the term, what is occupational therapy. They may know about it generically, but that's why the visual on the right-hand side helps so much. Common ways occupational therapists help patients, starting with number 1, teach new ways to perform daily tasks, and ending with the last one on the far right-hand side, show strengthening and stretching exercises. I can't emphasize the security blanket approach enough because she spoke for 7 minutes. Emma was a little bit more than 6. And more often than not, you're going to, if you're presenting it properly, over prepare. There we go. So we can get her eye contact in there. She has her webcam bottom left, keeping in mind that Emma had hers in a different location, upper right. She also has, Marilyn does, her timer right next to her webcam, so she's not having any issues in terms of managing her time. That brings us to our third summer informative speech, with this one being 2 years ago. This is Chloe Ray. We'll unmute. She's discussing heartworms. And for those of us who have had animals, this is something that's extremely important, that whenever you have a puppy or any kind of animal, you just have to be very careful that these are the types of things that are eminently preventable if you are proactive. And in Chloe's case, she is going to be informing us on the topic of heartworms. And here it is from 2 years ago, Summer 1, 2023.
Hey everyone, it's me, Chloe Ray. I am a pre-vet student at SAU, and this is my informative speech on what are heartworms. Heartworms is a very known subject around the United States, especially the southern part, just due to our muggy hot weather, which can cause a lot of mosquitoes. With it just raining today, the mosquitoes are going to be out when it warms up in the next few days, so make sure that your pet is on a heartworm prevention. So for my first slide of today's presentation is the definition of heartworms. Some of you may not know what heartworms are at all, but then some of you may know like a general representation of, oh, my pet has heartworms. So this is the correct definition for heartworms. It's a small thread-like nematode, which is also considered a parasitic roundworm that's transmitted through mosquitoes. After the mosquito bites your pet, the parasite travels through your pet's bloodstream and can cause serious damage to your pet's vital organs, which can lead to tons of symptoms that you may not know are actually caused by heartworms. Now, for this slide, we have effects of heartworms. Heartworms are considered a disease that make its way inside of your pet. Heartworms can cause many things. They can cause lung disease, heart failure, organ damage, fluid buildup, and worst case, death. In this video that I have attached to this slide, this is a case of fluid buildup, which is caused by heart failure. When the heart fails, you get fluid buildup in the abdomen, which is caused by heartworms. This is a very severe case. In this case, we insert little drains. We inserted 3 into this dog's abdomen, and we drain the fluid, which can cause relief for the pet, and it also helps them be able to breathe because that fluid will put pressure around your heart and lungs, which can cause your pet not to be able to breathe as well. This is all caused by heartworms, and many people don't realize this. They thought that, oh, her stomach is swollen, maybe she has a blockage somewhere. So that was her first thought, but our first thought is your pet on heartworm prevention? Now, for this slide, we have history and facts of heartworms. Heartworms were first discovered in 1856 on the southeastern coast of the United States. Now, this discovery was actually in dogs. This was the first discovery in dogs. But the actual first discovery of heartworms itself as the disease was discovered in a horse. Now, heartworms can have different effects on your dog depending upon the location of the heartworms in the body. When they are located in the right atrium, fluid buildup can occur, and that's normally our most common thing that we see when the heartworms are located in the right atrium. Now, when they are located in the left atrium, the dog will cough and continue to cough, and it honestly sounds like they are trying to dislodge something in their throat. So many patients that we see, their owners will think that something may be stuck in their throat or stuck in the roof of their mouth, but actually when you heartworm test them, it will generally come back positive due to this cough. Now, heartworms, it takes them 6 to 7 months to fully develop. In the next few slides, I will show a video of the baby heartworms, which is microfilaria. You can see them under the microscope. Now, that is them at their smallest stage. So it takes 6 to 7 months to get to their full length. A male heartworm can get up to 4 to 6 inches, while a female can reach 10 to 12 inches. That's kind of crazy, thinking that a dog may have a worm that's over a foot long located in their heart. Now, these are two pictures. Now, the first picture on top is heartworms actually in the heart, kind of showing you what they look like, where they might be located. And the other picture is actually heartworms that were extracted from a patient in a jar. It's really kind of cool working in the vet industry. We put many things in jars just because of how big of a discovery this is, just how cool it is to us in the vet industry. Now, this is used for education purposes. Just like now, I have access and am able to show you guys what this looks like. Now that I have you all very intrigued on my speech topic, the big question is what causes heartworms? This is a single mosquito bite. A single mosquito bite. We all get bitten by mosquitoes, but a single mosquito bite can give your dog the heartworm disease. And if your dog gets bit by this blood-borne parasite that this mosquito carries, your dog will be in harm's way. And due to our muggy weather that we have here in South Arkansas and North Louisiana, we see lots of mosquitoes. You walk out your back door and you're covered in mosquitoes. So just imagine if your dog is not on a preventative, they're covered in mosquitoes too, just like we are. But we take desperate measures of mosquito spray, so that's why you should take desperate measures of heartworm prevention. Now, this slide is possibly one of the most important slides that you will see in this presentation, is how to prevent. As of now, right now in today's technology, the heartworm disease is only prevented through regular use of prescribed medications. You can get these at your vet's office. These could be either a monthly chewable or a topical, a 6-month or 12-month injection. Our 6-month and 12-month injections are the Pro Heart shots, which I use on my dogs, and your monthly chewables or topicals could either be by Simparica Trio, HeartGuard. There's many out there. You just need to research your options and pick which one fits best for you. The Pro Hearts run on the expensive side just because of how good they are. You get 6 months of prevention for this much money, and you get 1 month of prevention for this much money. So for me personally, find it the better route to go the Pro Heart 12. All of them are very good preventatives, and we have seen no trouble out of any of them. Now, my last slide for today is how to treat if infected. Diraban is the #1 drug used for the treatment of heartworms. This drug kills and breaks down the heartworms in 3 simple shots. These shots are injected deep into the back muscle of your pet. They are alternated between shots, so one will go on the right, your second one will go on the left, and your third one and final one will go on the right. And the average lifespan of heartworms are 5 to 7 years. So if you do not keep your dog on a heartworm prevention and your dog ends up getting heartworms, this is a great route to go in treatment wise, just because it kills the heartworms so quick. I think it's like a 4-week treatment span. I'm actually having to do it on my rescue dog. Her name is Pickles. There's her picture right here in this slide. I rescued her 3 months ago and found out that she was heartworm positive, so we started the treatment 2 weeks ago, and she gets her next treatment next week. So it will be her 2nd and 3rd shot, and that will conclude her heartworm treatment. And within 6 months, she should be heartworm free. This heartworm case that we have is a very detrimental case. If you do not treat your dog can end up having some serious damage to their vital organs. Now, heartworms are predominantly in the southern part of the United States just because of our weather. And that is why heartworms are so widespread in our area, and it is so important for you to keep your dog on a heartworm prevention. I'm glad that I was able to give you all of this information. Maybe it will help you decide on what you need to do with your pet and what you may be doing wrong with your pet. Heartworms.
And that's the end of her presentation. Even though she's speaking more than 8 minutes, she has so much information she is discussing in a relatively brisk fashion. It does not feel like it is dragging at all. And even though some of the footage that she showed at the outset might be a little bit off putting for some, it's important to understand that particular process, because if you don't, you can't necessarily visualize how dangerous that heartworms can be. Look at that last quote. The lifespan of heartworms, and here you have some of the meds, is 5 to 7 years if left untreated. Imagine all of that pain that is not going to be taking place. Whenever you watch her in the bottom left-hand corner on a format, which I believe is different than Loom, she has an informal style, but that's okay. Whatever works best for you. Let's go through her storytelling structure backwards in terms of the visuals. How you can prevent heartworms with all of these medications that would be available at a veterinarian, depending upon how much money you're going to pay, obviously. And then the cause of heartworms, quote, a single mosquito bite can give your dog heartworm disease. Continuing, if this mosquito carries the blood-borne parasite, your dog could be in harm's way. Where we live, mosquitoes are almost inevitable to beat due to our muggy weather. And that's true. And then whenever we come back, that particular visual to many would probably be gross, where she's discussing heartworms being discovered in dogs in the 19th century. However, on the left-hand side, what you see is a plastic mold with what actually the heartworms look like pasta. And then when you see it over here, you can imagine how something like that would just be so damaging long term to your dog's health. The first animal they found it in was a horse, and she talks about this very well. And then whenever we scroll back, and I'm not going to play that video in real time, I'll leave it right there. She had that video on a loop, so you see over and over again the medication being given to a dog. She's not doing that to gross people out, but it shows you the serious nature of the effects of heartworms, which she says, quoting now, are considered a disease that make it way inside your animal. Heartworms cause lung disease, heart failure, organ damage, fluid buildup, and in the worst case, death. That is a nice encapsulation, that still frame of the way in which she has improved, as you saw the other two from last year, both Emma and Marilyn, the ease that you have on camera as time goes on. Let me just take it back here, mute the audio. I'm not going to worry about closed captioning, but just play it in real time. Look at her eye contact. Does she come across as being thoughtful, knowledgeable, informative, fact-based, and believable? All of you should not only mute the audio to check closed captioning in terms of a complete sentence structure, which you can see right there, but also focusing on your eye contact as I take the closed captioning off, primarily because whether you're speaking online or you're in a face-to-face circumstance, something I mentioned a few minutes ago, that believability, especially when you're informing, comes into play. So let me pause it, go back to her title slide and her eye contact, and leave it there for just a moment. 3 excellent examples of informative speeches from the past 2 years. Let me now go to my YouTube channel. I already have this set up on the playlist. Scroll down to informative speeches. The first presentation that I'm going to show you tomorrow when we are involved with informative speech topic selection is this one: homeschooling in the United States. That was my Monday night face-to-face public speaking course in Overstreet Hall, and the pandemic messed everything up, so we had to adapt on the fly. The person that you see here for homeschooling in the United States 5 years ago during the pandemic was the first person who ever used the Loom platform to record. But now let's just do a quick scroll, not mentioning every topic, but you have summer from 5 years ago, anxiety disorder, speech disorders, VARC learning styles, the importance of sleep, ADHD, attention deficit hyperactivity disorder, mental health in the United States, and that was before what we saw earlier today, asthma, energy, and there's the heartworm speech that we just saw right there, history of the Nintendo Wii console, so they don't always have to be dead serious, mental health, you saw that, occupational therapy, you saw that, and then we get down into persuasive speeches. And of course, in addition to this, let me now show you my website. A link to this is available at Blackboard. So for all of you, if you want to do a really deep dive into examples of informative speeches, you go to my website and scroll all the way to the bottom. All of the icons you see within these windows are going to open in separate windows that I told you last week for the demonstrative speeches. But all the way down at the bottom, I have my basic and advanced public speaking courses, and I'll leave it right there. So in these windows, where I'll go tomorrow from a slightly different location, you're going to find informative speech outlines, informative speech audio data, informative speech videos. There you can see how to make buttons. I already have that on my website. In fact, I believe form shooting is on here too. There it is right there. So I'm taking some of your works in real time and making them available not only on my YouTube channel, but on my website as well. And all of a sudden we scroll down beyond group discussions, which we don't do anymore, getting to informative speeches starting with anime and dozens of different topics that we will get to in 24 hours. Let me return to Blackboard. At this location for you, scrolling to the top, at this location, at the gradebook, you'll be able to check your progress with a maximum of 20 points on the speech, the announcement that I mentioned earlier about always sending me material no later than 2 p.m. on Wednesday for day 1 or Thursday for day 2 this week for your informative speech preparation. And then we'll wrap it up with content, coming back down to the course itinerary, which is under course syllabus. And a reminder that in 24 hours, we will be getting to informative speech topic selection. Everything you need to know is right there. We will conclude for the day by returning to my Loom library where you will see my face. I like the bottom right-hand side. I'm intentionally, probably for the foreseeable future, possibly for the rest of the first summer session, always leaving my webcam here at my Loom library. I will occasionally have a take that I don't like and will go ahead and erase it. But as you can see, there is session 7 with that link now available to you on Blackboard. As I indicated at the outset, we did a very positive job with demonstrative speeches last week. Now we turn the page with informative speeches, focusing more on research, data, analysis, and the 3 presentations that you saw from last year and 2 years ago are excellent examples from which you can start. We will continue in 24 hours with informative speech topic selection, breaking down different outlines and how you can maximize your importance in terms of the subject matter, how you want to put together your slides, and if you want to, as we saw with a couple of instances today, have video as part of your overall preparatory process. As for SPCH 1113, Introduction to Public Speaking, for the first summer session of 2025. That concludes the recording session for today.